Medical misinformation is everywhere. Dr. Mitch is here for straight talk and to give you the truth.
For a brief moment, I want to talk about two particular toxic metals, lead and arsenic. I think it will serve us well in the point that I'm trying to make. There was a notable study that highlights the impact of lead exposure on the human body and longevity. It was conducted by a Bruce Lanphier and their colleagues, published in the Lancet Public Health Journal in 2018. The study was titled Low Level of Lead Exposure and Mortality in United States Adults, and it was a population-based cohort study. The study found that a significant association between low level of lead exposure and increased risk of premature death, particularly cardiovascular disease. It suggested that even low levels previously considered safe have now serious health consequences. The research was analyzed by the National Examination Survey, the NHAID study, involving over 14,000 adults in the United States, and the participants were followed for nearly 2 decades to access the long-term effects. Now, the study reported that individuals with higher blood levels had 37% increase of all-cause mortality and a 70% increase of cardiovascular mortality based on people with lower or no levels at all. And here's the key. The study found that even low levels of lead in the blood were associated with a higher risk of death. The takeaway of this study, the findings suggest that there is no safe level of lead, and even low levels can especially affect your longevity. One more example, by the way. Let's talk about Habibul Ashans and colleagues' study in the Journal of National Cancer Institute in 2016. The study was arsenic exposure from drinking water, risk of pre-malignant lesions, and this was done in Bangladesh. It was an arsenic longitudinal study called the HEAL study. And they did find a long-term risk for cancer in drinking water, basically. Cancers including bladder and skin cancer. Now, this was a study primarily focused on skin lesion. Subsequent research did show that other cancers, including breast, are increased by the exposure of arsenic. And the cancer risk persists for years after the arsenic exposure stopped. The findings are a critical reminder that long-term health risks associated with arsenic and the importance of preventive and removing these exposure. It doesn't mean you just have to be overly exposed anymore. It doesn't mean you have to have high levels to think maybe I should remove it. And the truth is, if these things are ubiquitous, they're everywhere. And so the two examples that I gave, lead and arsenic, showing that even low levels can and do persist in the body and cause ongoing damage in the way of decreased lifespan, increased cardiovascular disease, and cancer, well, that should clearly serve as a powerful reminder that toxic metals should receive their own mantra. And that mantra should be test, test, test.